Hello, it's Rafael Gutierrez, and welcome to our channel. Now, today I'm going to do the tissues of the cardiovascular system and start just on the basics of the heart. I am going to use the lab manual I always use, which is my own. It's a $20 lab manual on Amazon. If you're interested, you could buy it there. CreateSpace. The idea behind this is to make it something that is useful with these videos that you could go through and actually learn anatomy on your own. If you're in a class with me, you'll notice that I actually do present a lot more information. And one of the big things that's going to happen is you're going to see a lot more structures that I put in that I didn't talk about. The reason is I'm trying to keep these videos small so you can use the lab manual and prepare before you get to class. I am doing this in a certain order, and it's the order that I like to teach in. It may not be the order that I always teach in because some schools have a schedule that they want you to keep. The reason I use the schedule is I found that it works better to actually learn everything than any other ways that I found. I hope you understand that things will be different. Other professors will find better ways to do it than I have for their own reasons. There might be something that they're stressing that I'm not. There might be I tend to stress more the clinical and usefulness of anatomy rather than just a straight memorization. With that, I am going to start the tissues. And I'm going to show you a lot of the tissues that we've talked about in the past, just so you can understand what's going on. And I'm going to give you some words. Always go back to the original words that I had you remember. So anterior, posterior, and I will give you some other ones like atrial and ventricular. Atrial for the atrium, ventricles for the ventricular. And I am going to start actually, before even talking about the tissues and everything, I'm going to tell you how everything developed. And I'm going to do it my way because, well, I can't do it some other way. So I hope you enjoy this. And to truly understand the cardiovascular system, it really does help to go into the embryology of it. Now, what we're going to start with is I'm going to start in week 2, where you end up having two tubes form. These two tubes are going to be what end up forming the entire heart. So we have two tubes in week 2. What ends up happening is in week 3, these two tubes fuse. You have a big tube which fuses and has a couple different distinct areas. You have a place called the tunica arteriosum. You have an area called the ventricle, kind of bulging. You then have an area which is the primordial atrium. And then you have this sinus venosum. Part of the tunica, just between the tunica arteriosus and the ventricles, you have a little area which is really important, which we'll talk about later, which is called the bulbous cordis. It's really important to realize that the head area is here, which we're going to call it the cranial end. And down here we have the caudal end. So we have the head and tail. It seems that something is off because I'm showing the ventricle above the atrium, and that's going to actually change itself pretty soon. So this is week 2. This here is week 3. And when we go into week 4, what we start seeing happen is the ventricle starts growing a lot faster than the atria, and the head actually rotates a little bit. And so what we end up having is we have this heart change shape. So we have the tunica arteriosus, the bulbous here, and then we have the ventricles coming here, forming this big structure here. Now the atria are going to be coming off this way here, the venous sinus over here. So we have the ventricle here and the atria here. So what you see is you see this S-type configuration happen, where the atrium is pushed upward. So you end up having pretty much everything where it's supposed to be. Now that's in week 4. We still don't really have a heart. And we move on to week 5. And in week 5, we start having a lot of different things happen. There is another thing I'm going to talk about later, which is the electrical conducting system, which comes from a specialized type of cells, which we have talked about earlier. In week 5, what we have is we end up forming 2 atria, and it has a little in the middle with a hole in it. It's an oval hole, so we call it the foramen ovalis. You have a little flap here. We call the atrial septum. Septum premium is actually the first one. This one here is the septum secundum. So first and second. And then you have your big ventricle coming here. We still have one tube coming off of it. So we do start getting these veins coming in here. We have veins that form around the heart. We have a hole that stays open here. It's actually a structure which is going to be called the coronary sinus. We also have a big vessel coming here, which is going to come in here eventually. Another one that's coming in there. One big tube coming off of this. That tube right now is called the bulbous cordis. So coming off the ventricles, we have one tube called the bulbous cordis. Now what ends up happening with the bulbous cordis is initially it starts as a tube, but ends up developing a septum between it. And this septum twists and makes it so eventually you will end up having 2 tubes. But initially, week 5, you still don't have that. You start putting valves here, and you also start making a division between the ventricles. By week 6, we now have a 4-chambered heart. Now, there is a couple things that I didn't mention. One of the things is, while this is going on, you have pharyngeal gill slits and aortic arches coming and separating off. The bulbous cordus ends up dividing into two arteries. One artery is going to come off and go into the left ventricle. So we have a right atrium, right ventricle, left ventricle. And we have a tube that comes off here and another valve here. And this valve really is above because of the way this is actually rotated. This atria, the valves are actually going to be lower than the valves that are coming off. As this is coming off of this area here called the aorta, this is the aortic valve. On the other side, and it would actually be completely on the other side, you have a tube coming off the right ventricle and going to a tube called the pulmonary trunk. And that one is going to have a valve here called the pulmonary valve. And so now you have the basics of how the heart forms. Now the reason this is important is sometimes these two vessels, don't move the way they're supposed to, and you end up having them on opposite sides. What that means is the right side is getting blood from the body, going back to the body, and it's a one-circuit, closed circuit, which isn't compatible with life unless you have other things that happen. Besides that, there are a lot of things you do have in embryology. For instance, in the aortic arch here, which is the blood that's going from the left ventricle to the rest of the body, you have a connection between the pulmonary arteries and the aorta called the ductus arteriosum. Eventually, we are going to get all the blood vessels, which I'm going to talk about and show you later. What I wanted you to see is how these vessels come about. And with that, I'm going to start telling you about the electrical conducting system. Pause it here on the pretty much top part of the right atrium. If we finish the heart here, pretty much between the right atrium and right ventricle. And you end up having these things called Purkinje fibers, which form down the middle of the septum, branch into left and right bundle branches, and then branch off to these little fibers called Purkinje fibers. This part right here by the way, is called the bundle of His. And so that's actually the basics of our heart. Here, again, I'm using my lab manual. So here, you can see the tissue that's found in the contractile unit of the heart. This is called striated cardiac muscle. Now, if you look closely, you can see some striations here, as you found in the striated skeletal muscle. The difference is, you can see the nuclei here. These cells are actually independent cells, sometimes one or two, sometimes three fused cells, and they have these lines here, which is called an intercalated disc. Inside the intercalated disc, you have desmosomes, which are glycoproteins which latch on from the cell, one cell to the other, and you have connexions, which are tubes which connects the cytoplasm between the cells. And so this allows the muscle to function as one unit. And so that's one of the first tissues that you're going to need to know is a striated cardiac muscle. Striated stripe, cardiac for heart, muscle, it's contractile. You're going to have simple squamous epithelium. Endothelium is what it's actually called. Simple meaning one cell layer, squamous, flat, epithelium. And you're also going to have a lot of other tissues. For instance, we talked about this one here before, which is your areolar tissue, which is actually found in the heart. We also have talked a little bit about adipose tissue, which you can see here. And we also have another type of contractile tissue, which is this one here. It's smooth. It doesn't have any striations, and that's one of the important neat things about it. The reason I'm talking about that in the heart is it's not really found in the heart itself, but on the vessels that help feed the heart and help feed the rest of the body, which you can see here. This is a slide of the artery, this is a vein, and you have the nerve there. One of the big things is this area here is called the tunica muscularis or tunica media, and it's where the smooth muscle is found. The inner layer here is a simple squamous endothelium, and the area here is called the lumen. Now one thing you'll notice is the lumen of the vein tends to be a lot bigger than the lumen of the artery. The tunica muscularis of the artery tends to be a lot bigger than tunica muscularis of the vein. These two would be connected, and what happens is blood flows from this artery to this vein. Now, if you think about it, if you have a tube which is going into a bigger tube, what you end up having is you have more space, so pressure will drop. As pressure drops, it means that a lot of the blood that's found in the veins isn't necessarily circulating. So these veins are a nice place for you to store blood. In this picture, you can see the entire heart. You can see that there's a division here. These two are your ventricles. So this interventricular sulcus, when you cut it, it's a septum, but outside it's depression. So anytime you find a depression, it's a sulcus. And remember that because you're going to use sulcus again later. So interventricular sulcus is a sulcus between the ventricles. As this one's on the anterior side, it's the anterior interventricular sulcus. We can also find a sulcus here, which is between the ventricles, and these two are the atrium. So it's the anterior atrioventricular sulcus here. You can also see a blood vessel here coming off, which is the aorta. You can see the coronary arteries. You have a right here and a left. And these are going to come around in something called the circumflex artery and connect in the back. And we'll talk about those when we get into the arteries and veins. We can see the anterior portion, and if we keep going, we can end up looking at the back, and we can see a posterior division here, which would be your posterior atrioventricular sulcus. And you have another sulcus here, which would be your posterior interventricular sulcus. I hope you enjoy this, and I hope it helps you find what you're looking for. Now, when I do the arteries and veins, one of the things I like to do is I do like to show you the anatomical marks that we've talked about. So it's a good idea to go into the muscles when we talk about this. Thank you, and have a good day.